Everyone, my name is Maggie Gossage and I'm a third-year student at the University of Alabama at Birmingham, working in Dr. Hendrick's Drug Use and Behavior Lab, and today my talk is on the knowledge and attitudes of Appalachian peoples on classic psychedelics and psychedelic-assisted therapies. So first, I'd like to talk a little bit about a region called Appalachia. So Appalachia is named after the Appalachian Mountain Range. It's an area of the United States encompassing 13 states and 420 counties, ranging from southern New York to northern Mississippi, housing about 8% of the U.S. population, or over 25.7 million people. So the area is lush with trees and rolling hills, making it a perfect spot for industries such as coal and forestry, and for hiking along the Appalachian Trail. So Appalachia has some of the most beautiful waterfalls, like this one right here in Russell Springs, Kentucky, where I live. So I've lived in Appalachia from my entire life, and growing up here, I got to experience all of the beauty of this place and all the love of the people around. But underneath this beautiful surface with these great people is a darker side. So Appalachian poverty rates range from 6.5 to 41%, over triple the U.S. poverty rate in some areas, with 87% of the region's 420 counties having 1.5 times the U.S. poverty rate, making everyday living a struggle for most of the people in this region. So mountaintop removal is also, it's a coal removal method that blows off the top of mountains to access small coal reserves. And this has contributed to immense population loss and habitat loss in the area, and immense pollution as well because of the large mining industry in the area. And a recent study has also shown that mountaintop removal independently predicts greater risk for depressive and substance abuse disorders. With this increased risk of exposure to health hazards comes increased health issues. Appalachia has seen death rates in COPD, cancer, and heart disease well above the U.S. average. This isn't helped by the fact for many Appalachians, prescription drugs are often out of reach and professional health care is only usually sought out in most extreme conditions. And in terms of mental health specifically, Appalachia is well worse off than the rest of the U.S., with Appalachian Medicare recipients reported feeling depressed at a rate of 16.7% higher than other U.S. regions, and the average Appalachian reported feeling mentally unhealthy 14% more days than the average American. Saddest of all, the region's suicide rate is 17% higher than the national rate, and in rural counties, it jumps up to 21%. This, coupled with the fact that in Appalachia, the number of mental health care providers per 100,000 residents was 35% lower than the national average, and in some subregions, this decreases to 50%. In conjunction with this, the Appalachian people see higher rates of adverse child life events than the rest of the United States, which are events that are significant disturbances in a child's life that impacts his or her ability to function in healthy ways. In a study of psychiatric patients in Southwest Virginia, 65% reported experiencing significant trauma, with the majority experiencing childhood trauma. And these adverse events increase the rates of mental health issues, and people having 6 or more of these events died nearly 20 years earlier on average of those without. Due to this combination of factors and many others, this placed Appalachia in the perfect position for the opioid crisis to take over. So the opioid crisis began in the 1990s when pharmaceutical companies assured physicians and patients that their products would not be addictive. So doctors began prescribing these substances at increased rates, unknowingly giving highly addictive opioid medications to many individuals living with chronic pain. So the information pushed during this time was wildly inaccurate, with studies now suggesting that up to 1/3 of people who take opioids for chronic pain misuse them, and more than 10% of people become addicted over time. Since its beginning, opioid death rates have increased yearly, and the drug supply becoming readily tainted with synthetic opioids such as fentanyl are making things a lot worse. As you can see on this graph, from 2020 to 2021, opioid deaths increased by over 10,000 people. That's 10,000 more siblings, parents, friends, and co-workers taken from opiates. In Appalachia specifically, many people work in manual labor jobs such as mining, farming, and forestry. So when opiates were put on the market for pain management, many people were prescribed this medication at high doses without knowing its addictive tendencies, putting people in a position to follow for addiction to begin. In areas of high populations and manual labor, such as Western West Virginia and Eastern Kentucky, opioid death rates reach almost 5 times the US rate, as shown in the darkest blue. Saddest and most unethically of all, dozens of physicians have been implicated legally for overprescribing medications in areas of Appalachia, with prescription rates of OxyContin 5 to 6 times higher than national averages in some counties. So if opioid use disorder causes so many hardships in people's lives, how are we treating those with addiction or helping to improve their lives? So currently medication-assisted therapy, or MAT, is the leading treatment method. So it involves using medications such as methadone and buprenorphine to help curb opioid cravings and ease withdrawal symptoms. However, there's some issues with medication-assisted therapy. Nearly all U.S. states don't have sufficient treatment capacity to provide medication-assisted therapy to all patients with opioid use disorder, and half of privately funded substance abuse disorder treatment programs offer MAT, and only 1/3 of patients with opioid dependence at those programs actually receive it. Also, getting off of these substances is immensely difficult for many people, and some end up staying on their medication-assisted therapies for the rest of their lives due to a fear of relapse, almost in a counterintuitive way. So we need to find other modes of treatment that could help people dealing with opioid use in novel ways. Recently, the realm of psychedelic science has shown promise in the development of new treatment methods for addiction using classic psychedelics. So classic psychedelics are substances including psilocybin, DMT, LSD, and mescaline that target and excite 5-HT2A receptors, and it's been thought to induce synaptic plasticity or the formation or strengthening of connections between brain areas. So these substances are being heavily researched currently, not only for the use of treating mental health disorders such as treatment-resistant depression or end-of-life anxiety, but addiction as well. So studies are currently underway investigating the efficacy of these compounds for a plethora of addictions, including opioid use disorder, alcohol use disorder, and cocaine use disorder, which we do in our lab. Treatments using psychedelics could be promising in regions of such immense addiction and the lack of mental health care providers due to the duration of the treatment and the fact that people don't have to go to the pharmacy or doctor every month for their medication-assisted therapy or their other mental health drugs. As promising as this seems for Appalachia, there are a few issues that need to be taken into account before moving forward. First and foremost is the legal standing of psychedelics as a Schedule I controlled substances, so rescheduling would be a first priority. Second is the lack of medical care in the region. So as I've mentioned, in Appalachia, the number of mental health care professionals is well below the national average, and the supply of specialty physicians for 100,000 population is 65% lower in central Appalachia than it is in the nation as a whole. So overcoming the obstacle of provider numbers is very important. So third is the relationship that Appalachians have with people they deem as outsiders. So Appalachians are known for having very strong family values and take pride in their self-sufficiency. That means that many don't seek out medical care and sometimes rely on folk medicine passed down. And the opioid epidemic has made relationships between Appalachian people and medical professionals rocky and have a lack of trust. So healing this relationship would be key to healing people. And the final issue is that we really don't know anything about the presence of psychedelics in Appalachia. There's no papers on usage patterns, knowledge, or attitudes, and most research is focused on the presence of opioid use, not basic research into knowledge and treatments. So, how will we approach these obstacles? First, basic research needs to be done on the prevalence and use of the knowledge and substances in these areas and how we can better communicate science and garner trust from people in this region. Second, we need to respect and understand the culture of Appalachia and use it to our advantage to help change conversations around mental health and addiction in the area so it's less stigmatized and more sought out. First, let's discuss a little about the research into this topic, or not, because currently there's no knowledge of usage patterns of psychedelics, perceptions of psychedelics, and knowledge of communities about psychedelics in Appalachia. So this is a gap that my current research study is aiming to close. So with the support of the UAB Summer Research Academy, I'll be doing a random digit dialing survey targeting Appalachian area codes. If consent's given, the person's demographic information will first be assessed, then we'll ask them questions pertaining to their knowledge about psychedelics and their usage patterns, if any. And then we'll tell them a short bit about psychedelics and the current research into psychedelic-assisted therapies. And finally, we'll give them a scale to get their framework of their trust in these new therapies and in the medical professionals giving them. Hopefully, this will provide a basis for education in the region about psychedelic therapies and allow for an easier time communicating with community members. I also hope this will allow researchers to target Appalachia in a better way and provide better treatment methods for this area. The next aspect we need to take into account is Appalachian culture. So Appalachian people are known for their independence and self-resilience, which can also look like a closeness from outsiders as well. They're very family-oriented and prioritize needs of the family and the community above their own. And religion plays a substantial role in the identity of the area as it's predominantly Christian. This being said, researchers and medical professionals are going to have to work hard to improve rapport between these groups, and they need to garner a sense of trust with their patients and provide information in a way that their patients can understand and be receptive to. It's also very important that medical providers go over the risks with their patients and take time addressing their needs and concerns, as many families have been impacted by the opioid crisis and drug education in the area is poor, so many people group psychedelics with other addictive substances such as opiates. So interestingly, in recent media, some Appalachians have been speaking up about their psychedelic use. So Sturgill Simpson is a prominent country singer from Appalachian, Kentucky, and in his songs, he sometimes details experiences with psychedelics, such as in the song Turtles All the Way Down. So as you can see the lyrics on the screen, marijuana, LSD, psilocybin, DMT, they all change the way I see, but love's the only thing that ever saved my life. So prominent figures in Appalachia being outspoken about psychedelics give promise that there's some knowledge about these substances in these regions, and this could allow for a smoother, easier introduction to these substances therapeutically. So as we've seen, Appalachia needs some help. With the novel ideas and therapies researchers and minds like Psychedelics are coming up with, I see a really bright future for those in Appalachia. Our duty as researchers in this wave of the psychedelic renaissance means that we must keep digging and researching, advocating for those who can't advocate for themselves, and helping out our fellow humans. Only through using the knowledge we've gained from our research to inform our decisions and open our hearts can we bring change and a sense of peace to a region so full of turmoil and sadness and impact the lives of people for years. Thank you. Questions and acknowledgements.